What we can offer a GP in our health board area is variety and choice. You can choose to be a generic generalist GP who focuses on your local community, and we really value that generalism. We value that as its specialism in its own right, and recognise that what that brings is the ability to look at the whole person and to care for the whole person within their community and their family. And that's a real strength, and many GPs want that ability to focus on their community and the patients on their list. But as an integrated health board, we also have the opportunities that if you want more of a portfolio career, if you want to link with our universities and undertake research and further training, we can make that possible. If you want more of a specialist role alongside your GP role and you want to work within our hospitals or work within our local communities as a specialist, we can offer you those as well. So we very much believe that we have variation and flexibility around your working hours, around where you would want to live, and in terms of the kind of career and career development that you want to pursue.
I'm really ambitious about what we can do in Hywel Dda. I think we've got a great opportunity to really think differently about how we deliver care to a population whose needs are changing. As a board, we are keen to work with our clinicians, get a very strong clinical voice in how we address some of those challenges. And my ambition is actually that Hywel Dda becomes a place where the delivery of rural healthcare is amongst the best in the country, and that we lead the way in some of the innovative thinking. So I'm looking forward to working with a great set of clinicians who are ambitious, who want to think differently, who want to innovate, so that we can continue to deliver NHS services to our communities.
For me, general practice is a vocation. It's not a job, it's being part of a community, it's providing support and care for your patients. We're still able to provide a cradle to the grave service, and it's quite nice now because I see patients that I've seen since they were babies, now they're going into secondary school, and also I get to look after people as they become older, perhaps develop more chronic diseases, and I've already built up a rapport and a relationship with them.
I wanted to be a GP somewhere where there was a chance for a long-term relationship with my patients and more of a community structure to the area. So I came back to South Wales and ended up back here in Llanelli. It was never my intention, but I'm happy that's how it turned out.
We have a lot of rural communities. As you drive through the area, you see sort of isolated farmhouses on hillsides, and that always intrigues me. How are we going to meet those people's needs? What do we need to do? And the benefit of working in our local communities and working with our local clinicians is they know these people, they understand what it's like to deliver care, and you can do some really exciting things together.
A misconception in some ways that if you're coming down to a rural place, you're going to be in the countryside, but West Wales offers loads of different types of places to work, semi-urban places, very affluent places, some very deprived places as well, and everything in between. If you wanted to find that idyllic rural type of practice, you could find that as well. So you've got more connections than you might realise. You may be distant from this university or that teaching hospital, but I think it breeds this spirit of excellence in what you do.
I just find it fantastic being part of a small practice where the ethics of traditional general practice could be continued, but also being able to give a standard of excellence that I feel is supported locally in other practices and with the health board, giving support to reaching a high standard of medical care, and because of that it's been very professionally satisfying.
I think there's lots of opportunities in general practice, as well as seeing patients. For example, there's opportunities to specialise, perhaps in a certain medical condition, such as dermatology or cardiology, and I think those opportunities will increase in the future.
I personally have a great deal of support from the cancer team and the palliative care team, because that's my area within practice. I've been very lucky to grow within this practice and be supported by my senior GPs, and I hope now that I'm becoming a more senior GP, I'm able to support those that are more junior to me within the practice.
There is support, good support within the area from the local health board and the trusts. If people do want to pursue particular interests, or gypsy interests so-called, yeah, there are opportunities there if that's what people want to do. I think because you work in a rural area, you get more opportunity to do procedures that maybe aren't done in other practices in more rural and more urban settings. So in that respect, you get a little bit more professional satisfaction.
As a Scot coming into Wales, I've felt very welcome, and not speaking Welsh has not been any kind of problem, although there is a lot of Welsh spoken in the area.
Patients may come in and say, do you speak Welsh? And of course, unfortunately I can't, but it's never been an issue. No one has ever been upset. Everybody is able to converse in English, so I wouldn't say it's a barrier.
My husband's a GP as well, and we both work part-time. I work 4 sessions a week and he works 7 sessions a week. So I think we've struck the balance really with a family life, raising 3 kids and work. I think we're very lucky to be able to do that in this part of the world.
Oh, yeah. Yeah. Yeah.
Get up in the morning and I'm headed into work. I think to myself, well, I don't know what's going to happen today, but I know it's going to be interesting. Sometimes it's challenging and difficult. Most of the time it's really enjoyable, and I think that's the unique thing about being a GP.
The benefit of working for an integrated health board is we don't do commissioning. We don't have to commission services from the acute sector. We are one health board. So instead of doing commissioning, we plan, and we plan services for our population. And we do that in clusters. We have groups of GP practices, anything from 5 to 8 GP practices working together as a cluster. And we pull into that cluster other parts of our health board and other essential stakeholders.
I did talk to some friends in a medical school reunion recently, and they were struggling with the problems imposed by commissioning and that sort of process in England, and the fact they're having to set up limited companies to commission services for their patients. And we just don't seem to have that extra level of worry and bureaucracy. So in that respect, we're somewhat slightly more masters of our own destiny and have slightly more control of things, I think, here in Wales.
When you're faced with the prospect of actually becoming a GP partner in a place like this, what you're doing is making commitment to the community that you live in. And that can be quite daunting sometimes, but actually I think it's probably the foundation stone of good healthcare. And people have been doing that in West Wales for generations, and I felt really I want to be a part of this, I want to see it continue, and felt ready to make that commitment.
If a young doctor wanted to train for general practice, which I think is the best job in the world, then it would seem sensible to come to a beautiful part of the world where there are so many opportunities. There's wonderful countryside, a lovely area to live, to bring up your kids, and an area where there's a strong tradition of social justice and equality, and excellence in training. It really is an area where you can come and flourish.
I think there's a number of reasons that GPs would want to come to the area. We have a system in Wales which allows us to link together in a much more coherent way how primary and secondary care work together. That's largely because we have very rural communities, and we have a system whereby the hospitals and primary care are all under the auspices of a single organisation. For a GP coming into the area, that means a number of things. One is that you feel much more part of a single organisation, and we work very closely with primary care at the health board level. But also it gives you opportunities to have different careers in primary care than you would perhaps get in a big city.
One of the interesting things that I've been allowed to do by the practice over the years is develop a portfolio interest in a number of areas. I worked as an educationalist for 20 years for Cardiff University. I've been involved in educating GPs at postgraduate level for some time. You do some undergraduate teaching. I've also become a lecturer in diabetes for Warwick University. So although you live in this area, there are a number of opportunities to do other things.
But in South West Wales, we have a network of excellent training practices. They are remarkably welcoming and friendly, very supportive to young doctors in training. And it's interesting, the feedback that we've had consistently over the last few years from trainees who've gone through have been really, really positive.
The training here for trainee GPs is, I would say, exceptional. I came through it only a few years ago. We meet every week, and that's all the registrars, so from year 1 to year 3. We get to do teaching on various subjects. We also do trips every term, so that's not only good for educational value but also getting to know your fellow trainees, so there's a good cohort there. And the training and those meetings don't end with us in this area. We have a first 5 group, which means that your first 5 years post-training, we all meet up once a month. We have sessions on things that we feel are important for us, so learning points that we've picked up. And it's also great to build a relationship with other young GPs in the area.
I think there's an opportunity for these people to come in and work with established practices so that in 3 or 4 years' time, when my cohort leaves and retires, then they'll actually have quite a high degree of autonomy in that they'll be able to run the practice, they'll be confident in terms of the business or the practice, and then they'll be able to set their agenda, their new ways of working, and that opportunity won't come very often.
I'm deeply passionate about the NHS. I think it's one of those very civilising things that human beings have come up with. It's there for when someone asks for help and another human being can give that help. I think the way that you deliver great care and great experience for our patients is by investing in our staff, by ensuring that our staff are able to do their jobs to the best of their ability. So some of the things that we can offer within our health board is the ability to link to universities. We are a university health board, so we have some great and developing links which will allow clinicians who are ambitious around research, around innovation, to be able to work with those universities to take that forward. And that's something I would really wish to support, because I think for me, having a workforce that is able to do some of those things ultimately benefits our patients, because it's about how we deliver new care in different ways.
We're exploring at present different ways of providing general medical services to our population. So some of the ways we're looking is how we could enable practices come together and work as federations, or how we could take away some of the administrative burden that general practice faces and centralise that.
We have some great examples already where our GPs, our local hospitals, our community nurses and social care are all working together. So if you went, for example, to somewhere like Llandovery, where we have a GP practice right next door to a community hospital, they're able to offer within that community something which covers all of the care and health needs for that local population, working as a team.
So we work in clusters. We have groups of GP practices, anything from 5 to 8 GP practices working together as a cluster. And we pull into that cluster other parts of our health board and other essential stakeholders, representatives from our community, professionals from our local authorities, so for social care, and we have fantastic third sector brokers who know everything there is to know about the local charitable and third sector organisations.
Being a GP in Llanelli is quite nice because the rest of the GPs are also very pleasant people. We all get along, the cluster functions well, we work well together professionally. We've got a good working relationship with the local consultants. They're all very supportive, very amenable, very approachable. We also have a close relationship with the local social services. We have regular meetings with our MDTs where we consult with social services, the local physiotherapists, district nurses. We all get together and discuss our more complex patients.
Well, I've been working as GP lead for the Health Board now for several years, and over this time I think we've seen an evolution of what we call cluster working, and that just means practices getting together to try and look at our population needs and to try and suggest and develop services, working with the Health Board and our community services and our specialist colleagues.
Working in clusters, groups of practices working together, I think is going to be a useful thing for sustaining general practice over the future in the area, for developing services. That's quite exciting. And the local health board are very much driving this forward, and with support from us, and they are supportive equally of us.
So in addition to my primary role of delivering ambulance services across the 2 health board areas, we also look to support primary care. It's been recognised that there are pressures in primary care, and our ability to work across professional boundaries is key to supporting GPs and the development of GP practice.
In terms of reference for this process.
We work very closely with our district nurses, and we will be more and more working with social services and managing budgets for our local populations as well.
We have, as part of that cluster working, a particular budget, so those clusters of frontline clinicians can actually start investing in services and pump priming services that they know locally will really benefit their population. And as a health board, we pretty much try and keep our hands away from that and devolve as much decision making and responsibility down to the clusters, down to our local communities, so that we're actually really responsive to our population and to the clinicians that deliver the care there.
The End Schedule Care Team is a new idea, and it's looking to support practices in ways that they can manage their daily workload and looking at it in a different way. So the way that we're helping the current surgery that we're based in is that we're taking off from them those people that are needing to be seen on the day. So rather than them phoning up and then all the appointments have gone, to be put onto a triage list, where at the moment I'm the person that's phoning them back. We do also have triage nurses who are helping with that role, so that we are working then as a team to triage those patients so that they are put into the most appropriate place or given advice and finished at that point. What happens with the house calls is that anybody who's requesting a home visit gets put onto the home visit list. Before we as a team started, that list would then be just divided up to the duty doctors of the day, and it tends to wait until after morning surgery. The way that this team is different is that the people still get put onto the list. I then phone back everybody that's wanting a home visit so that we're making sure that it's appropriate, that whether we need a district nurse to attend, whether the doctor needs to go, or whether we can use one of the paramedic practitioners from our team and whether they can go and see this person.
I'm a degree trained nurse, and I have 4 years experience in cardiac care and additional 4 years experience in accident and emergency, initially working as a band 5 staff nurse and then progressing to level of a band 6. Since then I've joined the ambulance service and was one of 4 nurses to do a conversion programme to gain my paramedic qualification. I've now been qualified as a paramedic for approximately 4 years, and during that time I've undertaken my Masters in Advanced Practice.
Where we're fortunate in the both health board areas and within my own trust is that we have very forward-thinking chief execs who quite clearly recognise the pressure that GPs face. The ability of practitioners to do, for example, house calls, which allows GPs to concentrate on more serious cases within the practice, is seen as key to successful delivery of primary care.
The only ones currently we're not doing are the palliative care patients. Anyone else we will go out to see. Any problems we have we'll discuss with the doctor, but in doing those visits we're able to take pressure off the GPs in the surgery. For an example, yesterday I did 7 house calls. The GP had to do 4, so had we not been there they would have had to do 11 house calls during that day.
Obviously, from an ambulance perspective, we want our advanced practitioners to be at the highest clinical level that they possibly can be, and that can only be achieved by a forward-thinking GP actually mentoring and supporting the practitioners, and that's the key element. One, it gives the GP confidence that the practitioner going out to do house calls is confident and able to, for example, independently prescribe, but more importantly gives the community the confidence that they're not always going to be seen by a GP, they're going to be seen by another health professional, and in many cases that will be an advanced nurse paramedic practitioner or simply an advanced paramedic practitioner.
I didn't know much about Wales at all before coming here, but since arriving here and working in general practice, it's been really interesting. I think it's been good for our children as well to experience Welsh culture. If you enjoy being outdoors, it's fantastic.
You can be in work 1 minute and 20 minutes later be lying on the beach.
I'm a very keen cyclist, I fish, I play cricket, and it's just a lovely place to live and bring up your kids.
And this is what it's all about.
Obviously from Swansea and Cardiff you've got fantastic rail links to London and beyond. So I think people don't need to be worried about being far away from the rest of the country, because you're simply not.
House prices are a lot less than you expect to pay in a lot of the other places in the country. The proximity of the area to the coast, to the Gower Peninsula, which is just across the bay there, which was the first area of outstanding national beauty in the country. Lots of nice beaches. We have a magnificent golf course, country parks, cycle paths, lots of leisure facilities. You can be inland in rolling countryside within a few minutes drive. Cardiff is an hour away by train or car for a night out if you wanted a big city life. It's a nice place to be.
Aberaeron is a wonderful place to live. And if I tell you that it was voted the best community to live in the UK by a recent Times article, I think that reinforces my point.
It's a different lifestyle here than I had in London. It's more rural, so country life, going to the sea, going to the mountains, it's all on your doorstep here. So I'm much less stressed. I get to know my patients not only as patients but as people. I'll see them out in the street and I'll be able to say hello, so there's a great relationship there.
We were looking for a home to raise our family, and we started looking around and realised we could get an awful lot for our money in this area, Carmarthenshire, compared with Cardiff or further afield. And we decided to move here, and we managed to have this lovely small holding, and we haven't looked back since. When you come home from work after a busy day, it's fantastic to come out and into the countryside and just switch off from work. It's perfect.
The lifestyle is so wonderful. I've even convinced my parents to move here.
Because it's a wonderful place. It's a marvellous place to live.
I can't see why anybody would want to work anywhere else, quite frankly.